like a lot of the data manipulation and processes that really could have been better automated through technology. But that 20% of the work that I was doing was great. It was really business impactful. It was actually what my managers and the executives within the organization wanted me to do more of, but I didn't have time to do because that other 80% was taking up so much of my time.
And now, from San Francisco and the UCSF Rosenman Institute, the Health Technology Podcast with your host, Christine Winoto.
I'm joined today by Frank Cheung, co-founder and CEO of Actuarial. Frank has held pivotal roles at Blue Shield of California, Deloitte, and Collective Health, leading efforts in risk management and value-based care. Frank's unique perspective is shaped by his extensive experience in both payers and provider settings. He has been recognized as one of the top 50 value-based care thinkers of 2024, highlighting his significant contributions to advancing healthcare analytics and supporting innovative care models. In this episode, we discuss the critical role of actuarial science in value-based care, Frank's journey founding Actuarial, the challenges of scaling actuarial capabilities, and his advice for startups aiming to make an impact in the healthcare industry. Here's our conversation. Welcome, Frank. Thanks for joining today.
It's great to be here.
It's so nice, and I'm so excited to have you here. And one of the things that I can't wait to share with our listeners for them to understand better the work that you do and the role that you play in healthcare. But before we start there, I always like to start with the journey, how you end up to where you are today, and what excites you to be in healthcare, and you're starting your career in being an actuarial. What does that mean either?
Yeah. Well, the journey was an interesting one. I kind of fell into the profession serendipitously, I would say, in that I didn't even know what an actuary was for most of my college days. I just knew that I liked math, I liked statistics, I liked econ. And, a friend of mine whose mom said, hey, if you are good at all those things, you should consider being an actuary. Again, I did some research on it, but still didn't really understand what it was until one day I was walking on campus and I saw posted on a flyer, hey, there's like an actuarial symposium going on, bring your resume, you'll meet some actuaries. And I said, hey, I've heard about this profession. So I kind of went in, listened to some actuaries talk about some stuff. I still didn't really understand what they did exactly. But I dropped my resume off and that led me to an internship at Blue Shield of California during the summer. And I guess that's what kicked off my career as an actuary.
And maybe like you were saying earlier, you don't know what the actuary is and what does that mean, what the work entails. Maybe you can help us understand, what is it? Most people probably don't know.
Yeah, I would call actuaries, the best way I would describe it are data scientists and data and financial analytics, but specifically for the insurance space. And with healthcare, obviously, so much of our healthcare space is insurance driven, given, if I ask anyone, hey, who's paying for that, inpatient stay or medical service or MRI, usually it's not the patient that's paying out of pocket. There is some entity, whether it be a government agency or your employer-sponsored health plan, that's taking up the bill. So our system is very insurance-based when it comes to healthcare. And as a result, the need for the type of analytics that actuaries bring to the table as it relates to modeling financial outcomes, contingencies, pricing, actuaries become very important and ingrained into kind of our healthcare system.
Does actuary is providing an analysis in terms of the risks that need to be measured in order for them to identify what's the right pricing to make sure that risk is being considered?
Right. So at the end of the day, if you just think about it quite simply as, a water funnel. There's two sides of the funnel: water coming in and then water going out. I think the best analogy I've heard is that the actuary's job is to make sure that water, quote unquote, I guess, money flowing into the system is consistent. There's no backlog. There's enough water going in order for the water consumption going out. So there's two components to that. One is understanding how much consumption or healthcare expenditures is going to happen. And, making sure that you're, analyzing, contracting, helping payers and providers set up the right structures to ensure that there's fairness in that compensation model. And then if you're a payer or you're an insurance entity, you have to make sure you're collecting enough premiums to ensure that it's meeting the needs of the other end of the pipe where the water is being consumed and flowing. So we really are kind of the regulators on both sides, because so much of it is, trying to predict like what's going to happen, trying to understand market dynamics and trends, and trying to incorporate that into the analysis that we are doing when it comes to, both pricing premiums, contracting, supporting payer provider contracting, and then also helping manage the operational financial management of an organization that is trying to figure out how to balance those two things.
Mm-hmm. And I always hear this, that when it comes to insurance health plan, be it, it's always that the actuary is the gatekeeper.
That is correct. I would say generally speaking, right? Because at the end of the day, there are business decisions to be made, and it affects, the business decisions are going to affect financial outcomes of running the business, and so much of it is contingency based. So you're kind of taking a guess with the best information you have, and it's really the actuaries that are taking all those business decisions and inputs and translating it into what the economic impact or the business financial impact is. And ultimately, that drives a big part of the decision-making process.
And that one of the things that when I think, like you were saying, is data scientists, like what kind of data that usually you need in order to make that good decision?
Yeah, traditionally, it's always been claims data, because really it's the claims data that give payers and providers the best picture about what providers are receiving and what payers are paying out the door. Now, the need for additional data points like, lab data, EHR data, et cetera, I think actuaries are starting to take that information in because they found it potentially helpful in getting more granular and specific and targeted with their models. So I would say historically it's always been claims data, because that's like the clearest source of truth in terms of money coming in or money going out. Depending on if you're the provider, it's money coming in. If you're the payer, it's money going out. But we've seen additional data sources most recently, given the availability of those data sources. But again, core is still claims data.
Mm-hmm. So you mentioned, like, when I think about actuary, I always think about insurance health plan, but you mentioned about provider. Do you think like providers also work with actuary in terms of setting their price?
And most definitely, because as we know, I mean, the line between a payer and provider is starting to get a little bit blurred, especially as we move, away from, fee for service to a value-based arrangement. So I think Kaiser is the best example of that, right? Kaiser operates their providers, they own their staff model provider system, but yet they own the insurance company as well. And with value-based care, what effectively value-based care is asking providers and hospital systems to do is become more like insurance companies and take on risk for, outcomes. So I would say that on the provider side, definitely there are, many providers have, actuaries, maybe not to the extent that insurance companies have, but the need for better, more robust, accessible actuarial and Medicon capabilities is growing exponentially, given the push from the market to get providers and hospital systems to take on more risk.
Mm-hmm. And I definitely also hearing more health system now moving into the health plan kind of business model as well.
Yeah, that's right. So you have, I think payviders is a good term that we've heard from, providers that are moving into the health plans. They're creating their own health plans. They're doing subcontracting with external providers. And so very much trying to operate more like a health plan than historically. Again, a lot of this is really coming from the push from the market to kind of have providers have more skin in the game as it relates to managing cost and outcomes.
So one of my questions is that there's a different clinical medical procedures that have the CPT code that is dictated by CMS. And how is that? What's the role of actuary, say, if you're not in Medicare, but say in Blue Shield of California, to kind of set the pricing for different? Is that so? Like, for example, if you have technology that you have FDA approved already, for example, and the provider said that this is something that we're going to is going to be very helpful to treat patients, but then I need to make sure I got paid. Is that something that the actual person in the health plan make that decision?
Yeah, I would say it would be a combination of actuaries, medical economists, medical informaticists, and as well as the medical director, the chief medical officer, the team that the clinical function within an insurance company. Because at the end of the day, there are really two main components of whether or not that new CPT code should be covered by an insurance company. One, there has to be some clinical justification and meeting the quadruple aim or quintuple aim. Like, is this service going to drive better patient outcomes? And so obviously that would be up to the clinical or medical director to kind of review and understand. And then there's the kind of financial component of it, right? Like, by covering this code, what is it going to do when it comes to like managing an insurance risk business? How much more are you expected to expend? Is that going to be offset by some benefits, like better patient outcomes? And so really it's the actuaries and Medicon folks within the organization that's working directly with the clinical folks to be able to come up with that story and understand, whether or not at the end of the day, net, this new CPT code, maybe for remote patient monitoring or what have you, ought to be covered.
And so I'm just trying to think, because now everybody always talk about like, it's so hard to get covered. And there's always, when people come up with their new innovation, they also want to make sure that it's being covered. And it's always, they found it, that's the hardest, hurdle. And what are the things that innovators need to think about when they want to make sure that their technology or innovation is getting covered, and what information they need to present in order for them to get the coverage?
Yeah, great question. Well, oftentimes the innovators are coming at it from a clinical and patient experience perspective, right? There's a patient access issue for a particular type of service, or they believe that, for a particular type of clinical condition, this new kind of service can drive better outcomes. And maybe that's true. But at a component that like that's one half of the equation, just like I had mentioned, remember it's clinical plus, business economics. The other half of the equation is really having a clear picture of what the insurer is saying as it relates to cost and utilization and what care as usual is now. So what the insurance company is going to do is going to say, well, okay, great. If this is the population that you're looking to manage, what are we paying for this population? What do their cost and utilization patterns look like? How much are we paying? And is there an opportunity to kind of improve not only clinical delivery, but how do we map that clinical delivery to kind of the business and economic justifications of what would happen if we do implement it? And there are going to be different types of considerations because, one is, okay, well, if we allow for the CPT code to be reimbursed, well, how do we ensure that it's not, it's not overused in a negative way, right? Because that is definitely possible. So there are different types of considerations, but at the end of the day, I think for any kind of startup that's trying to kind of break into the space, being able to clearly understand the population that you're targeting, that you're looking to kind of implement this new service or solution, and understanding like what's the health plan's perspective on how much it's costing them right now, and being able to map your clinical model to that story, and tell that story in that way is a really important component of being able to find traction in that market.
And how does like an innovator find all that information? And it's oftentimes it's not easy to get. I mean, if you're in Blue Shield, you have all that claims data, but if you're sitting in outside, it does not come easily.
Yeah. So, and I guess this is where, there are organizations that can help, and I would say Accorded is one of those organizations, right? Like you can procure or license claims data out in the market. You would bring those claims data in, and you would try to analyze them the same way, hopefully the same way as an insurance company would, in order to kind of really understand what they're looking at before you make the case and you present to them. So I that would be kind of what my recommendation would be, is that there are entities out there that can help you do that, Accorded being one of them. But the idea is to really kind of understand, hey, like what how do I ensure that from a health plan's perspective, as they're thinking about running an insurance company, while you're thinking about delivering medical clinical results, how do you ensure that what they're seeing, so that you can craft your financial business case in a way that really resonates with them?
Mm-hmm. And before we talk about Accorded and your journey in starting Accorded, one of the things that I wonder, like you mentioned earlier, do you feel that the actuarial and health plan, has it changed since you started, or kind of like it stays static? It's just those are just little noises that kind of you adapt and adjust.
So the actuarial community is relatively small, especially in the healthcare space. So, from my time working inside of a health plan, as well as consulting for health plans, as a consultant, and then from, my fellow colleagues that are still work inside a health plan, not much has really changed as it relates to how they work and how they operate. It's remained pretty consistent. So there hasn't been a lot of advances to date around, actuarial work. And if you think about just proportionally, I think it's been accepted on the health plan side that, the actuarial function as an administrative cost is so critical that it's just going to be a percentage of, your book of business. So if you think about the insurers that have the most actuaries, it's going to be the insurers that, have the largest book of risk business. And you start with United and you kind of work your way down. And again, it's been accepted as this is the cost of doing business. It's going to be a percentage of how big my book of business is.
Mm-hmm, mm-hmm. All I know is that when you're an actuary, you have to pass the test, and it's really difficult test. So whoever becomes an actuary is a really smart one. That's what I was told.
I would say that they're really dedicated to passing the tests. They really want it.
Yeah. So,
yeah.
I one of the things that I want to ask you about what got you thinking about what, I've been doing actuary for a health plan for a company. Why the desire to start company in the space?
Yeah, I think the mindset is similar to, I would say, most founders that you've talked to, Christine, in that they see something that they feel like it should be better, or there's more efficiency to be gained, where they look at a world, the worldview is whenever they see something that they feel like there's improvement involved, that they want to pursue in making that happen. And so for me, it was, after 15 years, working as an actuary, both as a consultant and within, a company, I just realized that the need for more actuarial capabilities is going to increase, both within the health insurance side, given the move to value-based care and the analytical demands that opens up, even within a health insurance company. And then not even considering the other half of the healthcare market that's being asked to be like an insurance company. There's going to be so much demand for actuarial services and Medicon capabilities that I really saw no way for the value-based care to actually meet its full potential unless we really solve for this particular issue. And so the only way to really do that is for technology to come in and deliver these capabilities more efficiently and effectively and at scale for all stakeholders within the healthcare system. And, coming at it from an actuary, I also saw an opportunity where, I think most actuaries would feel the same way. Like when I was working as an actuary, I felt like 80% of the work that I did um, was really kind of rote grunt work, like a lot of the data manipulation and processes that really could have been better automated through technology. And but the 20% of the work that I was doing was great. It was really business impactful. It was actually what, my managers and the executives within the organization wanted me to do more of, but I didn't have time to do because that other 80% was taking up so much of my time. And so even as an actuary, I feel like that right now I'm building the solution that I would have wanted as an actuary to, make me 10x more productive and also a lot happier in my day-to-day job.
Mm-hmm. So tell me more about Accorded then. Is the Accorded is it for the actuary or is it more like helping the innovators to get the actual work done?
It's both. So what's unique about our platform and our analytics solution is that we meet our users where they are. And what I mean by that is that, for our business users, the non-actuary, so to speak, there are certain kind of data assets and outputs that they're looking to, there are certain business needs they're looking to achieve through kind of our ability to provide actuarial analytics. And we can deliver in that very specific way to serve their data needs. Now, when it comes to like the more analytically inclined, let's say it's the actuary or the data scientists, again, I would say 80% of their work is a lot of kind of data manipulation, calculations, code set mapping, et cetera, et cetera. And that's all work that we've kind of built and internalized in our system. So this is what our own actuaries use in order to make themselves more efficient when we deliver to our business stakeholders. We're using that same technology platform and saying, hey, if your analytics team wants us to kind of manage that 80% of the work so that can free them up to do more value additive things, we can also deliver in that way as well. So I would say our core focus is to help the business users, the early stage companies, really kind of get into the market and really provide them with the core actuarial analytic capabilities they need to really succeed in a world where, they need to show how they're making an impact on cost of care. And some of them, or actually most of them, need to be able to figure out how to take on risk for those promises. But at the end of the day, we've built that technology platform to also be useful for, actuaries in their day-to-day work, data scientists in their day-to-day work. So really kind of we can meet those needs of the, more institutional payers and providers as well.
And so thinking about for as an innovator, at what stage is a good time for them to start talking to a company like you?
We've worked with companies that are from pre-seed all the way to post-series B growth stage. And what's unique about kind of our solution is that we're not one size fits all. It's not like an enterprise solution that like you need to buy, which clearly for the earlier stage companies, they're completely priced out of those solutions. We are designed and built to scale and grow with companies. So, from pre-seed, where we help companies kind of present their business case for their pitch decks, and now they're, all the way to Series A or B, that was really exciting for us to be able to help there. And then for those growth stage companies, obviously, the need for more analytics as you grow, that becomes oftentimes a blocker for growth. And so us being able to kind of solve those needs for those companies is also, that's kind of how we're designed. So I would say that I don't think it's ever too early as you're formulating a business to understand what the market is seeing and being able to position your solution in a way that addresses the cost of care concerns of the market. I actually think that I don't think it's ever too early to start thinking about it and figuring out what that positioning is.
Yeah, no, I think it's very, very important. Oftentimes, people found out about that later, and I think it's better to know early on.
Exactly. Exactly. You don't want
targeting.
to find out. You don't want to find out later that like, oh, the size of the pie that we're dealing with is just not enough for a, you know, payer or health plan to pay attention to.
Right. Which is kind of the unfortunate reality.
Yeah.
I think oftentimes you see, it's for a good cause, but then it's not a big enough problem for the payers to lift their finger.
Exactly. Yeah.
It's but yeah. So I was shifting gear, and so now you're running a company. I was thinking about being that must be like it's a different kind of task in a way from the actuary for a health plan, where health plan tend to be very very slow, at least the reputation, and it's very everything is
Uh-huh.
very bureaucratic, or but then you have a lot of experience in doing consulting. It's also in a company that's not as big as a health plan. What are the things that you learn in past your experience before you start the company, and is there something that you can look back and say, oh, or this is completely that you're doing completely different 180 degrees from what your experience is?
Yeah. So I really had to learn how to be a founder and a CEO. Managing people, I would say, was never what inspired me to like go to work every day. But so much of being a co-founder and CEO is really kind of finding the right people, managing the right people. Um, and I'm still learning on the job because being a technical founder, like someone who really kind of knows the industry, knows the technical elements of what we're looking to build, the 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 running a company aspect is a learning experience every single day. And I'm still learning, still improving. I'd probably still like not even at you know at 20% of what I could be in terms of the type of like manager, CEO that I should be. So it's an area where just being aware that it's a very different type of job role and responsibility, and then ensuring that you have the right people, um, ensuring that you have the right people kind of holding you accountable for that development is important.
Yeah. And I think, well, that's good. It's, when you are in an environment that you can continuously learning, I think that's make it exciting. And dealing with people is always a lot of variety, right? Um,
Yeah, I think, but it's good though, right? Like I think people bring in their own strengths within an organization, and I think I was lucky in that when I first started the company, we had brought in a lot of folks that I had worked with in my past life, right? So we kind of know each other. We know our capabilities, but that comes with its own challenges too, right? Like having that past experience, oftentimes that familiarity kind of the challenges there are different. But as we've brought in people like from net new people that we haven't worked with in the past, I do see kind of that transition and that mix to be an interesting kind of dynamic. But at the same time, it's how a company grows. Ultimately, you're bringing in early stage. Your core team is those that you kind of are familiar with. And as you're bringing in new folks outside, they bring a level of perspective that I think is really good. So there's that as well.
yeah. And what part of your role that you really found it is really exciting and rewarding, that you never knew that it will be there when you started the company?
For me, I think I didn't have my eyes set on any type of like grand prize when I started the company beyond, hey, this is a problem that I want to try to solve. And so it's always been kind of like just looking just a couple steps ahead. Like, how do we get to the next phase? How do we take a step forward in solving this what has been truly an intractable problem when it comes to scaling actuarial analytics. We've tried to do it. I've tried to do it when, I was at a health plan. I tried to do it as a consultant, but it's always been a difficult nut to crack. So in that sense, I would say what gets me excited and motivated, it's just these little wins that happen. When we are able to help a company really move the ball forward and get their first contract with a health plan, right? When we are able to kind of do some analysis and they say, hey, this is completely game changing when it comes to how we position our solution, how we think about it, and how we communicate it. That feels really good. And ultimately, it's those things that every time I hear about it, we're okay, we're making progress. And then so, you got to take your wins while I can, because obviously there's just so many challenges when it comes to starting a company, that every time you have a win, there's, probably a couple of issues that pop up that you're going to have to deal with. And you're going to feel oh man, is this going to be the end of it all? Or how are we going to deal with it? And so, you just kind of take the wins as they come. And even if it's small, but, really helping these companies, with capabilities that I would say that traditionally have been left out. There's just no way they would have gotten them because it's either too expensive, too slow, too time consuming, and really Accorded being there as a solution has been really great, because I would say that it's been really rewarding to see these companies that have traditionally not been able to afford the level of analytics that we're delivering, be able to get them.
Yeah, and I think that is such an important piece in their business strategy, especially in the healthcare space. I think that's helpful. Well, thank you for your time. I really appreciate yours explaining to me a lot of different aspects of the actuary. Really appreciate you sharing that insight.
Yeah, thank you, Christine, for having me. I appreciate the time, and thanks for the great conversation.
Thank you for tuning into today's episode of the Health Technology Podcast. We hope you found the conversation insightful and inspiring. If you enjoyed this episode, please take a moment to subscribe, rate, and leave a review on your favorite podcast platform. Your feedback helps us continue bringing you the latest in health innovation. Stay connected with us on LinkedIn and Twitter for updates on upcoming episodes and more. Until next time, keep pushing the boundaries of what's possible in healthcare. I'm Christine Minotto, and thank you for listening.